get going. So thank you everybody very much for joining us today. You're joining UNC Health and our twice weekly media briefings that we're providing to media in the area to keep them apprised of what's going on inside UNC Health facilities. Today's briefing will focus on operations and planning at rural hospitals in North Carolina, specifically within the UNC Health system. Our three subject matter experts are from Johnston, Chatham, and Wayne counties. They will be discussing how we're treating patients during the crisis, protecting staff, and preparing for more cases in the setting of rural hospitals. And so now I will turn it over to my UNC Health colleague, Alan Wolf, who will introduce our three guests. Alan?
Morning, everybody. Phil, you did a fine job. I'll just mention their names and their titles and pass it off to them. Tommy Williams is Interim CEO at Johnston Health, which has hospitals in Smithfield and Clayton. Janie Jaberg is President CEO of Wayne UNC Healthcare in Goldsboro. And Jeff Strickler is president of Chatham Hospital and also runs our Hillsborough campus. Tom, do you want to start off with a few opening remarks?
Yeah, sure. First, I'd like to thank all of you guys for this opportunity, and anytime that we can assist with any questions from the media or the public, we're glad to do so. I think at Johnston Health, we are currently, we've been busy. We saw some of the first COVID patients in early March. And our staff has risen to the occasion. Of course, we have hospitals in both Clayton and Smithfield. Our Smithfield location is where we have been seeing our COVID patients and have been doing most of our preparations for. And of course, we'll go into more detail with that as we extend it.
Janie, go ahead.
Thank you, Alan. Good morning, everyone, and thank you for the opportunity to share a little bit of our story. We here at Wayne are a sole community provider. We have an incredibly amazing group of teammates and providers who are very dedicated. Just real briefly, a couple of quick little vignettes that will help you see how critically dedicated these people are. We have a patient who video chats with their family every day. We had a patient who had an incredible, important family engagement that they really wanted to make sure that that family could enjoy that with that loved one who was dying. So my point is our teammates and our providers are going above and beyond. So for that, I'm incredibly proud. The community has rallied around us, and I want to just have the opportunity to make sure that I say thank you, because I am blown away every single day on what this community has bestowed on us. So thank you for the opportunity, and I look forward to sharing more of our stories as we continue the next 30 minutes.
Great.
Right ahead.
And Jeff Strickler? Oh, sorry about that.
Yeah, and I'll relay my thanks as well to everyone for participating in this call this morning. It's always a great opportunity to talk about the needs for the rural hospitals in our state, and in particular talking about the needs of Chatham County. Chatham Hospital is a 25-bed critical access hospital that's located in Siler City. The last several weeks have been challenging for our organization as we've prepared to respond to the COVID-19 pandemic. The last couple weeks have been, particularly challenging as we've had a couple different outbreaks in our community. But the silver lining in this is the level of community partnership that we've had with a number of organizations across Chatham County, and just seeing how we're all working together, rowing in the same direction to best care for the individuals in our community. And so that's been a great thing to see and experience once again. So thanks for this opportunity to participate.
So now we would like to use the majority of the time for your questions. You can, if you have a trouble connecting audio, you can use the chat function and send us the questions that way. But the way we've been doing these, and it's worked out pretty well, is just having individual members of the media step up and begin asking questions. So please go ahead.
Hi, this is Richard Stradling from the News and Observer.
Hey, Richard.
How are you? I gather that the smaller hospitals are more dependent on the non-urgent surgeries and procedures that have been, the kind of which have been postponed to prepare for the coronavirus. I wanted to ask if that was true and what the thinking is on when you might be able to resume some of those.
I'm happy to jump in. Thank you for that question. I think I can speak for my colleagues that yes, we do count on those procedures for a couple things. One is that we have to take care of our community and we need to be here to do that. But of course, as far as a revenue stream, it's important as well. It has impacted us significantly. We here at Wayne have reduced our emergency room visits by 50% and our inpatient volume by about 35%. And we are not doing any procedures unless they're urgent or emergent or significantly a priority patient that must be done. We would like to be able to slowly start developing a process to put in place that we can bring that back. However, we have to be very cautious for a couple of reasons. One, we have to make sure that we maintain those levels of PPE, which you all know what that is, personal protective equipment. So we have to make sure that we maintain that. And second, I think everyone on the call is aware of what is happening at this correctional facility. We are watching that every hour. So we're managing that and using that as one of the guidelines of when we can at least consider to ramp back up.
Janie, I think that's perfect commentary, and to put some numbers on that here at Johnston Health, since early March, we have postponed just over 300 elective procedures and/or cases. I think it was certainly necessary because we had to preserve and conserve our PPE and also want to be sure we had enough disposable supplies for when emergent cases come in. But you're absolutely correct. It is a significant financial hit. We too, along with the system organization, are looking at when we can start ramping up those cases, certainly for the financial implications, but also more importantly for those patients. You figure those 300 plus patients, they need that care, they need those procedures, even if they are elective. So we want to go ahead and start meeting that need and lowering that backlog. Certainly as we come out on the other end of this pandemic, one of the things Janie mentioned is that ED visits are down up to 50%, and that's not just for our system. I think we're hearing that across the state and the nation. You figure that patients with stroke symptoms and cardiac and heart symptoms, or it's not because they're not having those symptoms anymore, they're probably just a fear of coming into the hospital or getting out, and that's certainly worrisome. So I think we'll have a backlog of cases and needs that we'll need to address once we come out on the other side of this.
I want to add one more thing to this for the folks listening. What you just said about people that have stroke and chest pain and some of those really critical emergent needs, if you all can help us get that message to our communities to not come in, please come in. We will take care of you. I know there's some concern about coming into organizations about COVID, but our goal is to take care of you, and we don't want you waiting at home if you have those urgent medical issues. So please go to your local ED if you have those. So if you all can help share that, it would be great.
Yeah, I'll mention.
Oh, good.
I was just going to mention a little bit about the Chatham experience as well, and then also highlight what Janie had said. So, our situation is the same as Tom and Janie has said. It's been a significant revenue impact for our hospital. One of the unique variables, though, at Chatham Hospital is one of our key service lines is a post-acute or rehab patient population. And so we've actually taken a number of patients from the medical center to be able to decompress them, to be able to take more of these COVID-19 patients. So our inpatient census has actually been extremely high. And so that's been one of the other factors that we've had to deal with. But as Janie said, it is important that we get the message out that we're fully prepared to take care of patients and keep them safe. if they have other medical needs. And so specific for our hospital, we've got 2 work streams. There is those that we're suspicious of being COVID-19, and there are those that aren't. And so we've built into our systems how we can help protect individuals that are presenting for other needs.
I had a question, well, 2 questions really. One being I know some people are concerned, due to lack of insurance or not knowing what their insurance will cover. What's being done to help people in terms of financial assistance with COVID-19 treatments? I mean, to make sure that they don't get, an exorbitant bill when they leave. Because I've read around, and I know in some states, it can be close to $100,000 to get treatment for this virus. I just wanted to see what's being done to assist patients on that end.
I think first and foremost, all of us, and I'm going to speak for all of us, will take care of a patient anytime, any day, for any reason, regardless of their ability to pay. And we don't even ask, we don't know. We just bring them in, triage them, and take care of them. At the end of this, and I think part of the answer is we don't know. We don't know what's going to happen at the end of this. But what I will tell you is we're going to take care of patients regardless of their ability to pay. I don't know if my colleagues want to add any more to that.
I completely agree with you, Janie. I'll also say that, as a system, we work with individuals on the back end of the whole case. So as you said, we worry about the clinical needs first, and then we work with them to assure that they're able to take advantage of any financial assistance programs that are out there or that they're qualified for, and then work with them as far as putting kind of reasonable terms and conditions in place for whatever their expense may be. So I feel like UNC has always done a really great job in trying to make sure that we meet people where they are.
Yeah, that's our mission, taking care of patients across North Carolina. And I think it's one of the benefits of being a part of a larger system, because it gives us a lot of flexibility to work together to meet those needs.
And then the other question I had has to do with, the governor's plan and phases, obviously, to reopen North Carolina, specifically in Johnston County. I wanted to get, Tommy, I wanted to get your reaction to or what your thoughts are if Johnston County is ready to be reopened, and any concerns that you have as a hospital administrator.
Sure. I think it's a very fair question. It's one that the board members and our community leaders and family members have questions about all the time. And I honestly do not envy our board members in retail, because there's 2 ends of the spectrum here. I can speak from the care. Always I'm going to err on the side of taking care of patients. That's what I've done since I got out of high school and went straight into healthcare. So that's always going to be my focus, is what's best for the health of the community. But also on the other end of the spectrum, it's certainly no denying that there are people that are very worried about their next paycheck, because they don't have a paycheck coming in, and they're worried, when are we going to open back up? I think what I would hope for, and I think our leadership in the governor's office is doing well, is that they're having communication and listening to both sides of that. There's always going to be 2 ends of that spectrum. And we know, example, that if we just stay closed, we can probably continue to manage that. We also know that's not reasonable. So the other end, if you're a family and you're trying to get back to work and you want to reopen, if we open up tomorrow and the floodgates open, we also very likely will be overwhelmed with patients and be challenged to take care of them. It's got to be a middle of the road approach, and it's got to be where we follow science, we follow our epidemiologists, we also have people in economics that we can listen to, and it's got to be a balanced approach of that. I think the approach of opening up slowly and managing this is the appropriate one, and I think that we do it in such a case that we can evaluate and look at how we're being impacted with the cases and how we can manage those cases. But I think the approach that is being considered now is probably a reasonable one to ramp back up. And then let's all work together and communicate together.
And as you ask your questions, members of the media, if you would please just say your name and which organization you're with would be great.
Hi, I'm Lynn Bonner with the News and Observer. We've seen some outbreaks at long-term care facilities, prisons, and now potentially meatpacking plants. I'm wondering how these outbreaks have figured into your calculations on how many patients you might get, and I'm wondering if you've set up localized testing sites at some of these locations.
I can speak to what we're doing in Chatham County, which is where we have a couple large food processing plants in our area, as well as we've also had a skilled nursing facility that had an outbreak as well. So it certainly does change our calculus, if you will, of a projected load that could be impacting a hospital such as Chatham Hospital. So it's something that we've been working with them, watching closely and working with community stakeholders such as the health department, emergency management, and others. Specific to the skilled nursing facility outbreak, we were really reliant on the expertise from the medical center, which put a team in place that went into those facilities, did testing, put together a nice best practices guidebook, which we shared with that facility as well as other facilities throughout our county. With the food processing plants, we've also been working with the plant leadership and all various county stakeholders, as well as the state. And so the state is stepping in and doing some mass testing at the particular plant, and then looking to duplicate that process at others across the state. So again, it's all of us working together to respond to this. And continue to keep a watch on the numbers and adjusting accordingly.
I will echo what Jeff said. We as well are facing some hotspots in some skilled facilities, as well as everyone's aware of what's happening at News. It has changed our directive. It has changed our calculations. We talk to them very frequently. We are continuing to maintain that relationship because it's very important. One of the things we have done at Wayne, we are a larger facility than what Jeff has. So we were able to take one of our units and make it a COVID dedicated unit with negative air pressure. And I know Jeff has done some of that as well. We've also been able to have a dedicated COVID ICU unit, as well as now we are opening a third COVID positive unit that we will be able to maintain those patients, particularly from the prison, should that occur. It's something that we watch all the time. As I said, we're working with them, we're working with all of the state officials, and we're working with the epidemiologist and the infectious disease folks at UNC to help us manage through this process. But it absolutely has changed the direction of which we are looking at.
One of the positive notes on that I hope as we go through this and continue that we will continue, I think it's changing care plans across the county in these types of areas. To give you an example, the skilled nursing facility here in Johnston County that had early outbreak, we've been working with the care that's received there, and of course the cooperation we've had with the Johnston County Public Health Department and our group here at the hospital. We have a lot of communication. Our chief medical officers in communication daily with their medical director. Our infectious disease physician went and rounded 2 weekends ago with that medical director at that facility with the Department of Public Health here in Johnston County, so we could have input and discuss their care plans and also ease the ability to transfer when needed and or care in place. 6 months ago, we had never done anything like that before. And I think when you come up to a pandemic and these types of critical, it just increases the communication across the board. And I think that's something we'll take away from this that'll help us in the future as well.
Great, thanks so much. Additional questions?
Jeff, so testing is happening today, that mass testing in Siler City at the Mountaineer Farms. And I know you guys have a smaller facility. Are you guys making any changes today in case the number of positive cases increase following that mass testing happening today?
Actually, we're already ahead of that. So, I mean, we had a number of plans in place, just how we would respond to any, patient surge, hoping that it, wouldn't occur, but then, being prepared if it would. We have seen our numbers creep up, and so we're continuing to work our various contingency plans that we have in place, and looking, at the positive cases in our county, and that gives us an estimate of what we can expect to potentially see coming through our doors. And so we've already beginning to shift. As Jenny was talking about, we've had a space that was identified for these patients. We have begun to sort of overflow into another space, and so we've already went to our next level of contingency plans for this. Our emergency department has not yet had to activate any types of contingency plans, but we've got a 2-level split flow plan which enables us to increase our capacity, and as I had mentioned earlier, keep potential patients that are known to be positive or we're suspicious of being positive away from the patients that are presenting with other types of complaints.
Hey guys, I'm wondering if you can hear me.
Yes.
Okay.
Yes.
Ken Connors with Goldsboro Daily News. Of course, we keep hearing about medical facilities needing this equipment and not necessarily getting everything that they need. I know Wayne UNC Healthcare partnered with the college here locally to work on getting some of those medical supplies from the community. Is that a continuing problem? Is it especially a problem for these rural hospitals?
Well, Ken, hey, how are you? Good to see you.
How you doing, Janie?
Good. I'll go ahead and start with that one. Yes, the college has been amazing, as has the community, helping us with supplies. It's going to be an issue, I think, for a long time, and I think that both Tom and Jeff will agree with that. Today, right this minute, we're good, but it's something that we continue to look at and plan for. As Jeff commented about the potential increase that he may see, and when Tom had his beginning hotspot and his increase, those things make you start to think, wow, how we call this is our burn rate. How quickly are we using these supplies, and what supplies are our biggest concern? We look at that twice a day. We as in the executives, but of course our teams look at it every minute. But I think we're always going to have to stay on top of that. And being part of UNC has been helpful for us. But we all have to rely on ourselves to make sure that we've got the supplies that we need. I hope that answered your question, Ken.
Yeah, I think as a system, to let you know how important it is, we have a dashboard that everyone in the system can look at, and we know exactly through our resource management team what PPE supplies that we have. And as Janie said, we're monitoring our burn rate each day, trying to look at predictive numbers as how much we'll need, and then also how much is coming in, what is backordered, and what is being difficult to find. So that communication is a tremendous help to us.
And the value as a system. So, I mean, we much of our supplies, particularly for Chatham Hospital, comes from a central location from UNC Health system. But we've also pivoted with the various hospitals. So, my 2 campuses, we have shared supplies with different campuses when they've had a shortage, develop. So I think that's one of the great things that being a system can provide to us in this type of a scenario.
And I'm glad you brought up the community help as well. The donations that we have received across the system, not just at Johnston Health, have been absolutely incredible. I think the community connections has been so much appreciated. As I said earlier, I get daily and weekly calls from the county commissioners asking what we need. Our representatives are always reaching out to see how we're doing, and that support has been very much appreciative. Yesterday, I'd asked our team here to start keeping up with everyone that had donated any and all supplies, and not just that, anything. I'll give you another example. There was a Clayton soccer league, and the young ladies of that soccer league all wrote notes of encouragement. And we had a local restaurant to donate a lot of cookies, so we attached those notes of encouragement to those cookies, and we rounded and handed them out to everybody. And you just can't imagine what that meant to everyone that is here working to get those notes of encouragement from that soccer league. So yesterday evening, I sat down and I signed just over 200 thank you notes. And that's just the start of what we're doing to send out, because it just gives you an idea of the volume of people that have reached out and helped from the community. Those links to the community are just so precious and have been so helpful.
We've got a question here from Brighton McConnell with WCHL in Chapel Borough. Brighton, go ahead.
That's right, guys. How are you doing this morning? And thank you so much for taking the time. This question is largely for Jeff because we cover Chatham, but it also sounds like it would very much affect the other two as well. Jeff, how challenging is it to hear about these cases from long-term care facilities, kind of knowing that they have their own protocols and practices and how that might differ from how your campuses are working to mitigate the spread of the virus?
Well, I mean, I think the impact that, we were all concerned about any type of an outbreak in any type of a congregate type of a facility, and certainly one that's a older adult facility. As I'm sure everybody's aware, this particular virus, it has much more impact on older adults, and certainly that those are in a facility where by nature being there, they have other chronic disease states and other comorbidities associated with them. And it's also then, hard from that standpoint because we have limited things that we can really offer in that setting. And so Tom had mentioned that really we're working with those facilities to provide care in place. So that's one of the challenging aspects, particularly with those types of facilities. When we look at some of these other, outbreaks, it's different things then that we're focused on because we're dealing with, younger patient populations or those that may be living in a much larger communal housing types of settings. And so we constantly find with this virus that we have to pivot in different ways based upon whatever the circumstances of that particular organization is.
We've got a question from Celeste Garcia. She had typed in. She said, there's a general question. This is for anyone that could answer. She says, you've been talking about the preparations making for COVID-19 patients and how you're keeping track of how many patients to expect. But she's wondering if there's been enough cases to support those preparations and vice versa. And do rural counties tend to have less cases? Obviously. So are you finding that you have more equipment than patients, more patients than equipment, and so forth? If you'd like to answer that. And we've only got a few more minutes. So if someone would like to take that one, that'd be great.
I'll jump in and see if I've got this right. I think that we really planned, like I'm sure Tommy and Jeff did, for the worst. And that was the direction that we are directed. And frankly, we haven't stopped planning. We have had incident command set up for 7 weeks now. And we continue to plan for whatever this could be. As far as do we have enough equipment? If the worst comes, I don't know if anybody has enough equipment. All we have to do is look at what's happened in some of the states across our country. But I think that at least in the rural communities and at least at Wayne, we have planned for what we think we can possibly do. And it's pretty significant for being the size community that we are. Now, knowing that we have News Correctional, some of our skilled facilities that can continue to grow, and we could have a lot of patients come in a short period of time, I'm going to go back to the fact that we are part of a system. And we have the opportunity to work with that system to care for patients if we don't have what we need, or if we have more patients than we believe that our own hospitals can handle. That is truly a blessing for us. I do think in the rural community, one more comment I want to make, we all know each other. It's a little bit different than the bigger cities. I think that's one of the differences that we all have, is we're all families and friends and neighbors because we are small. And anything that happens in any of these skilled facilities impacts us all personally. Not that it wouldn't impact others, but most of the time they're friends and neighbors and families. So I think in a rural community, we have a little bit different role that we're playing than maybe some of the bigger facilities. I don't know, Jeff, you were shaking your head.
Yeah, and I was just going to say that, we did have the experience of not having a lot of cases early on. And so it was a little hard within the organization to keep the message out. And we were, as you were saying, preparing for the worst. But now we're beginning to really, see this. And so that dynamic is really, changing. So I think it highlights the fact that with this virus, it's more of a marathon, not a sprint. We all had sort of that initial focus. This virus is going to be with us for some period of time. And we need to think about how we respond to that over a longer period of time than perhaps any of us have really had a lot of discussions around.
Yeah, Janie, you're correct. I like the way you said in smaller communities, everybody has each other's cell number, and most of the times we're related to the ones that we're caring for in our care teams, and it's real. The emotion is real, and I think that sharing of responsibility and communication is important, and that's what we see in these rural environments. It's what makes it special, and also sometimes what makes it challenging.
Well, thank you all very much. It's 10:31, so we've actually went over a little bit. We greatly appreciate everybody that joined us today. We're doing these twice a week, so we hope you'll be able to join us on Mondays and on Thursdays, and we'll try to vary the content, so we'll find a fresh take on this every time. So there will be a recording of this posted on our YouTube channel and then on our resource page on the internet. So thank you very much again, and that will conclude our media briefing for today.